now joined by two members of PAM Health. I'm joined by Mr. Joe Ramos. He is a nurse practitioner and the new CEO for PAM Health Specialty Hospitals of Victoria, Miss Nikki Robin. Welcome.
Thank you.
Thanks for having us.
Yes, I always love to hear from our friends at PAM Health. It's been a little while, so I'm glad that we're back. And we're recognizing, although it is October, we're recognizing Peripheral Artery
Disease Awareness Month.
Disease Awareness Month.
Which was September.
Which was September, but it's still important to highlight because this affects us all year round.
Absolutely.
So talk to us about peripheral artery disease.
So peripheral arterial disease is a problem with circulation. Circulation is where there's inadequate blood flow and either narrowing or complete occlusion of the vessels that carry blood. And so on average, about 1 in 5 Americans over 60 are affected by this problem, and it increases your risk for stroke and heart attack by 4 to 5 times.
Oh, wow. And how can you detect this?
So for peripheral artery disease, we specifically are discussing lower limb. And so lower limb symptoms are typically things like numbness, tingling of the foot or leg. Sometimes people will describe feeling of cramping or pain on the back of the calf when walking, only relieved by sitting. And so those are some symptoms that develop over time slowly, and people tend to brush them off as if, you know, it's just old age, arthritis, and a lot of times they go undetected for many years until there's an ulceration that happens. And that's where someone like myself comes in. I'm a clinician. I've been practicing as a nurse practitioner for over 15 years. And so when I see people that have lower limb wounds, one of the first things that we look to evaluate them for is to see if there's any peripheral arterial disease that's playing a role in that, in efforts to save their limb, because it does increase the risk for amputations.
Yeah, you have to keep those arteries healthy to keep the circulation going, keep the leg alive. I know I'm under 60 or 65.
Of course.
But I do feel occasional numbness time to time, or even like you said, like a cramp. I always just brush it off as dehydration.
Right. So oftentimes these are problems, again, that occur over long periods of time. There's some basic testing that can be done in places like Victoria at their PAM Health Wound Care Clinic. There's a simple ABI that can be done, that can be performed by our nurses and clinicians there. Can help detect what your risk level is for active PAD.
And is it something that can be detected through an annual physical or a routine blood test?
It's part of general workup, and I'm sorry I'm answering.
No, you're the official.
But for the clinical piece, obviously, absolutely, there are some basic testing that can be done in a physician's office or in a wound care clinic or a medical clinic that is equipped to do it. And so a basic test is an ankle brachial index, and it's basically we take a blood pressure of the arm and we measure it compared to the pressure of the ankle, and that'll give us an index, and based on that number, based on that value, it gives us an idea how well that circulating is getting down to the lower leg.
It's a lot of math. A lot of math, it seems like.
Yeah.
And we're so lucky to be able to have that testing screening here locally in Victoria because of the specialty hospital.
Correct, and the great thing about PAM Health is that we offer many levels of care for patients that experience PAD. From a patient that may have been in a traditional acute care hospital that had an ICU stay, we have our long-term acute care hospital, which is basically a bridge for those patients as we're still taking care of their clinical needs and preparing them to maybe go to our inpatient rehab facility and then transitioning to our outpatient centers, whether it be for outpatient wound care, infusion, or therapy services.
Well, it's truly a gift to have PAM Health here in the Crossroads. We are a rural area, so any